Hi, everybody. Welcome to Family Matters. Today we are joined by Dr. William Mansbach, and our topic today is how can I determine what is normal forgetfulness versus changes in memory? Welcome, Dr. Mansbach. What a great topic.
Thank you, Len. It is a good topic, so I'm looking forward to having a conversation with you about it.
We're looking forward to hearing about it. Before we get started, can you tell our Family Matters audience a little bit about yourself, your background, and your current role at Counterpoint Health Services and Mansbach Health Tools, home of the BCAT?
Sure. I mean, my primary training is a geriatric clinical psychologist. I specialize in geriatric neuropsychology. So I guess you would say that I focus on the evaluation and treatment of memory disorders or dementias, as most people think about them. Most professionals would know me as the creator of the BCAT cognitive ecosystem, although many providers would know me as the CEO and creator of Counterpoint Health Services, where we provide psychiatric memory care services to long-term care, mostly older adults.
Great. Well, I'm sure in your roles, you've come across lots of folks who may be experiencing or reporting forgetfulness, and
Yes.
those that may actually be experiencing some real changes in memory.
Mhm.
So let me start off by asking, when does normal forgetfulness kind of cross the line into something that requires, medical attention? What should older adults and or family members be sort of looking for if they think there's an issue or they think a pattern is developing?
Very good question, Lynn, and I think one that is confusing to older adults, their families, and frankly, to a lot of providers. So let me start with the context, which is that there's no such thing as absolute fidelity in memory. In other words, our memory system is not set up to be 100% accurate or faithful. So when we think about memory, we think about memory errors. So one way of considering your question is, well, what are errors that are just sort of normal things that happen versus a more reflective of a pathological process in some ways? In general, kind of the top line description would be forgetfulness is normal. It increases as we get older. Frankly, I think by age 50, we tend to begin to have some forgetfulness episodes. I think this will be familiar and maybe reassuring to anyone who's watching this who might be 50 or older. 50 is an arbitrary number, but we kind of like that one for a number of reasons. So, and there's a whole neurophysiological explanation for why we become more forgetful, but and we can go down that track later, time permitting. But essentially, forgetfulness is the result of errors in attention. It might be that we're not paying attention. It might be we're distracted by both internal issues, pain, fatigue, or external ones. You know, we have demands placed on us all the time. I mean, think about it. We might be taking care of kids or grandchildren. We have jobs. We constantly have these recursive simulations in our head that get in the way a lot. So errors in attention. And you might think about forgetfulness as something that can occur, will occur, increasingly will occur non-pathologically, because the basic equipment of the brain for making new memories is still mostly intact. So the error is not due to structural damage or problem. As opposed to memory deficits that are associated with a true memory disorder disease like Alzheimer's disease or vascular dementia or any of the dementias for that matter. Because in that scenario, there is a structural or neurochemical reason or explanation. It's as if a person no longer has the capability of making memories, again, not absolutely, but as well as they used to. So if you're taking care of somebody who has a memory disorder, has let's say Alzheimer's disease, and let's say they're maybe in year 4 or 5, you'll see memory problems, but sometimes the person seems to be doing pretty well. You know, they have a good day, their memory's better, and so forth. So efficiency gets compromised because of the underlying neural anatomical changes. Eventually, with progression, a person just loses the structural ability to make memories. So forgetfulness is normal, pathological memory is not.
That's probably very reassuring to those of us that are always saying, where did I put my car keys or where are my glasses? So some
Exactly.
of that is normal and we need to be sort of mindful of that.
Mhm.
Okay. If family members out there are noticing maybe this is starting to impact day to day, so maybe their loved one is making financial errors, forgetting that they made purchases or being unable to manage decisions around finances or, getting lost on their way to someplace familiar. I think these are things that we hear a lot from family members, my loved ones repeating themselves all the time. I think something's going on. Where can they turn for first steps to get, support? What are the right steps to follow to engage with a healthcare practitioner to maybe get some answers?
Yeah, so there's a lot to unpack in all that. I mean, you could first look at the impact on just function, activities of daily living, or the more complex or instrumental ones. I think you would say that we often first see memory issues, maybe more than forgetfulness in those areas. So they're very applied. Ecological is one term that we use. An example might be that a person is forgetting to complete appointments. Maybe they're forgetting to take a medication. Maybe they forgot that they ran the dryer again for the third time, and it's the same clothes in it, stuff like that. So that provides a context for a caregiver or family members or concerned people to say, "Oh, I see something in real life that's different." It's a little different than the kind of memory issues that may be derived in such a way that we see people repeating themselves over and over again. I mean, it's a little less functional, but certainly we begin to see those kinds of things. So I would say for families, I would follow the adage: once is an event, twice is an occurrence, three times is a pattern. Um, that doesn't mean, I mean, all of us are going to be forgetful more than three times, but in the same way, it becomes a pattern. And when we see that, we begin to think that something is different. And the something is different is the second fundamental principle, which is it should represent a change. Mom didn't always do this, but she's doing it now. Why is she doing it now? So I think when you begin to see that, it's important to have a conversation with other members of the family. And let's not forget the older adult themselves. It's easy to do that, to sort of objectify mom or dad or brother or sister or whomever, but you want them to be part of the solution, especially because, in answer to your question, an evaluation is likely going to take place. Now, I'm a I'm a supporter of um, sort of step by step or incremental assessment. And what I mean by that is you don't have to run to your doctor and get an MRI. I mean, start with a cognitive screen, maybe an at home screen, something like my mem check or something like that, and just see if there seems to be, in a more standardized way, a problem. And if there is, I would elevate that to a primary care physician or a healthcare provider that or knows your loved one very well. And then maybe it's time to do an actual cognitive test of some sort to see if there's something going on. And then based on that, there might be imaging that could be done, like an MRI or a functional MRI or a PET scan or something like that. So because a true memory disorder is going to be progressive, it's important that you try to recruit the older adult so that an assessment can take place.
And sometimes they will be the first to say, I'm really struggling, or I know why I keep, having this same issue over and over again. So we want their buy-in. We want them to be part of the team because we're going to need them to participate in whatever evaluation, as you described, is appropriate to start to get some answers. So I like the idea of including the older adult in all the discussions. They are, an important component to helping engage and determine, next steps for this.
And
I
then
really think,
I would add one thing to that, which is we focus a lot on memory and disease state. We probably should. I mean, it is relevant in some ways, but our view is really focusing on function is really critical. One can have some accelerations from forgetfulness to some real memory issues, but the idea is to support a person functionally so they can be as independent as possible. It doesn't mean, okay, let's go to senior living right away or go to a nursing home or memory care right away. I mean, sure, sometimes that's indicated, but let's preserve function. Let's support function as much as possible.
yeah, and sometimes there are workarounds. I know some of the older adults that I've met have automatically implemented some systems on their own, like, oh, well, now I make a to-do list or I put a post-it on the front door if I'm taking something with me the next day. They start to create their own systems to
Sure.
support their memory, and they recognize that they have to have, some kind of compensation to be more successful. And that's great. We can include that in the big picture plan. It sounds like from what you're describing, waiting around and hoping that this is going to go away isn't the best approach. So early identification and reaching out for support. If there's a diagnosis, like you mentioned, maybe there's some type of dementia, can really be key ingredients to maximizing their long-term outcomes or the benefits that they can receive from professionals. Can you tell us a little bit about the timeline and that sort of early diagnosis, early connection to healthcare professionals and the advantages?
Sure. Let's disabuse someone from the idea that the primary reason for a diagnosis is to get pharmacologic treatment. So what I mean by that is normally, under most health conditions, you try to come up with a diagnosis so you can implement an effective treatment. Unfortunately, as of today, effective treatments are non-pharmacologic. So you want to do an evaluation mostly to identify as opposed to diagnose, identify what's going on and its impact on function. Um, and to get a sense of progression. Progression is really important because you want to be able to plan. So our view is you identify what the issues are, you understand their impact on function, and your interventions, which tend to be more a suite of cognitive, maybe working memory and related interventions, that whole idea is to slow things down, but support function in real life. So, sure, early diagnosis is important. If someone is at, let's say, the mild cognitive impairment stage, but leaning toward a progressive illness like Alzheimer's disease, Alzheimer's disease could be a 10-year illness. It could be shorter, it could be longer. So the crossover point for when a person needs support becomes paramount, I think, as part of the evaluation.
You mentioned memory exercises, some types
Mhm.
of cognitive interventions that older adults and their families could consider as part of the follow-up to diagnosis. Can you tell us a little bit about how cognitive interventions work and why they're beneficial?
Yeah, yeah. So first of all, most of the ones that are out there, there is no evidence that they do work. So one has to be, the first task is to choose evidence-based ones. So you'll be familiar with this term, Lynn. Rather than reading, oh, this digital exercise is based on science, you want to be able to read that it's validated by science. Anything can be based on science, but it needs to be validated by a proper study in some way. So we are very bullish on some very specific cognitive exercises, but it's because there are validation studies, or at least they've been involved in either improving, let's say, memory, since this is about memory, or improving function in some ways. So we do and have done quite a lot of research in this area. We have at the BCAT, we have a cognitive exercise suite that we feel very strongly about. So if you're watching this, that is one option. There are other options too, but just make sure that the science is actually there to support, because otherwise it's an opportunity cost. You're spending time doing something that you think is going to help, and it may not help, and therefore you're not doing something else that could be more effective.
That's good advice. I know we've been hearing a lot in the last few years about not just looking at the cognition, but looking at holistically lifestyle factors, things that maybe you can change that are small changes or
Yep,
big changes that can impact your overall health. I know there's a lot of talk in the industry about brain health and how to improve your brain health. Can you tell us a little bit about, what is brain health and how does that play a role in this?
sure. So as I define what brain health is, I'll use an analog in some ways. If I said, well, what's physical health? You would easily say, well, physical health is optimizing, if not maximizing, our biomedical abilities to function in our lives and attain the highest quality possible. And I would say the same thing is really with brain health. Brain is an organ. We're often thinking about it in terms of its cognitive components or corollaries, but brain health is really about preserving and improving brain functions such that we can psychologically, cognitively live a more fulfilled life. And the interventions that you're really talking about, or the brain health, lifestyles and real world situations, are really, I can translate that into modifiable behaviors. That would be things that anyone can do, although they may have to be adaptive in some ways. Anyone can modify to improve brain health. And I'll give you some obvious examples. Um, so we all know that cardiovascular exercise is really good for our physical health, and we also know that it's very good for our cognitive and psychological health. So it's a modifiable behavior because you could do more or less of it, depending on kind of what's the sweet spot for each individual person. So I'll give you seven, what we call the brain health seven, and then I'll add in a few more that are a little bit more metabolic, but still modifiable in some way. So physical exercise, really important, arguably the most important. Cognitive exercise, we talked a little bit about cognitive interventions that you can do that would perhaps improve memory, but certainly improve function. Um, so doing the right ones. So working memory exercises that have been validated by science can really be very helpful. Modifiable behavior, if you do it, 5 times a week, even 3 times a week for 15 or 20 minutes a session, and they're the right kind of thing, you're driving down the lanes of neuroplasticity, and that's exactly what you want to do. Third, and this may surprise some and delight some, and that is what we refer to as centered breathing or certain meditative practices. Doesn't matter which ones they are, really. And the reason is centered breathing activates the parasympathetic central nervous system, which is really all about calming our systems, lowering cortisol and other stress related hormones. And that actually helps your brain, your central nervous system, mitigate the negative downstream impact of cortisol and other kinds of stress hormones that might impact on the limbic system, particularly the hippocampus, which is implicated in making new memories. So center breathing is the third really important. The fourth one I think of as one of the key daily hygiene exercises, again, modifiable, and it's sleep. Sleep's really important. We've done interviews before on sleep. We've done a fair amount of work on sleep. We really believe that you should be getting 8 hours of sleep, roughly speaking, plus or minus 1 hour, regardless of your circumstance. But the more you have cognitive issues, the more important it is. And that has everything to do with stage 3 sleep, slow wave sleep, and REM sleep. So that's a whole sort of interview, I think, on its own. So that's a fourth modifiable behavior. A fifth one really is on diet. So that won't surprise the audience because there's a lot that's out there on diet. We advocate something called the mind diet, although we're no longer so supportive of the alcohol piece. We used to be supportive of one glass of red wine, but certainly you can do that without alcohol. Those phenols you can get that from apple cider and from lots of other grape juices and things of that sort, particularly without the sweetener. So diet's important as well. Um, Meaningful engagement, that is time with others, that is meaningful. By meaningful, I mean that it activates a sense of belonging, that it also activates old memories that kind of help with memory consolidation and that sort of thing. And then finally, in this group of seven, brain health seven, a mood regulation. So that may be a little different, but mood regulation is important because the happy neurons like serotonin and others can really become subtractive when we're having stressful situations, and that can impact on brain health, particularly on things like memory as well. So those seven are important. I said I would throw in a few more. So um, keeping your blood pressure in a reasonable range is important. That's a modifiable behavior because there's things that you can do about it, whether they are antihypertensives or just the things that I already mentioned, like walking and diet and sleep and things like that. Um, and weight, but weight is a little misleading. I mean, healthy weight. And by that, you're really trying to avoid things like type 2 diabetes because that probably by a factor of 5x increases the risk for dementia and so forth. Now, that does not mean that if you have type 2 diabetes, you're in trouble. It just means that this is something that you must modify in some ways. So perhaps that answers your question. There are many things that we can do to improve our brain health.
It's really encouraging to hear this list because these are things people can control and start tomorrow. You could change
Yeah,
your sleep patterns and habits, tomorrow. If you're a night owl and you're getting 4 hours of sleep, you can start to change, your time you go to bed and hopefully encourage and change that pattern to get more sleep. If your diet is unhealthy, you can start taking things out one at a time. These don't seem like really hard, challenging changes. They're kind of small incremental changes that somebody could make that could have
right.
a really big impact down the road.
You can think about it this way. By improving your brain health now, you're delaying trouble later. So there's something really wonderful about having a sense of agency or impact, that there are things that you can do that can make your life better, that can make your brain health better. I'm not saying that it's always simple, but the levers you can pull are simple. Sometimes they're stuck, and sometimes they're heavy and hard to move, but nevertheless they are there for us to move.
And I think not just for maybe the older adult who's having the memory issues or forgetfulness, but for the loved ones and the caregivers out there who also want to maintain their overall health and their brain health. These are great tips for both the family member and the families.
Oh, sure. I mean, it's really scary when you're taking care of someone, right, who has a memory disorder, and you're it, and it's incredibly stressful. It's even arguably more important that if you're that person that you're practicing brain health. Actually, you said something else that is really bears kind of pulling out a little bit because it's so important, Lynn, and that is kind of the age of starting all this. I went to some years ago. I was invited to talk to the clinical leadership of a very large healthcare system about sort of the role of memory and interventions and all that for their patients. And I said, look, you really should be treating or supporting memory care when people are like in their 40s, long before they begin to show symptoms. Part of that is for illnesses like Alzheimer's disease, we already know that the architecture of the sort uh, of the plaques and tangles that are related to, let's say, beta amyloid are present 20, sometimes 30 years even before someone becomes symptomatic. But establishing patterns, behaviors that are healthy, makes it so much easier down the road because you've always been doing that, right? It doesn't seem like it's something new and hard to do.
Yeah, change can be hard. You don't want to do it all at once. So if you can start this sooner and master each component of the Brain Health 7, if you do start to have changes or issues as you age, you're one step ahead. You already have the modifiable lifestyle piece in place. So I think this is great advice, is to kind of take action sooner than later, and how to follow that incremental plan you described. From, is this a pattern? Do I need to connect with a healthcare professional for some type of cognitive screening or assessment to start really getting on the right path to address these issues, if they are? If it is forgetfulness or converting into a memory issue, this will help put folks on the right road. So great information. Thank you so much for your time today. I know this will be really helpful and meaningful for our family members out there. So we appreciate your time.
Thank you, Lynn. I really enjoyed it.
Thanks. Thank you, everybody. That concludes our Family Matters session today. Come back for another one next time we post one on our BCAT YouTube channel. Thanks so much.